Hello and welcome to an introduction to patient-oriented research. This is part of the DERS Education Workshop series, and it is a pre-recorded workshop. My name is Alia Janiwala. I'm a knowledge translation specialist with the BC Support Unit Fraser Center, which is a team associated with the Department of Evaluation and Research Services at Fraser Health. I'd like to start today by acknowledging that Fraser Center and Fraser Health provide services on the traditional, ancestral, and unceded territories of the Coast Salish and Nklahkutma nations and is home to 6 Métis chartered communities. Today's pre-recorded workshop will introduce the strategy for patient-oriented research and the BC Support Unit, our team. It'll also introduce patient-oriented research, also known by its acronym POR. We'll unpack some POR and community-based core principles, community-based participatory research core principles. We'll discuss what is patient engagement and also dive into some examples around how Fraser Center supports POR and how you might want to access some of our services to further a conversation or discussion around how patient partners might be able to advance some of the work that you're doing at Fraser Health. The learning objectives for today are to acquire foundational knowledge about POR and articulate why it is so beneficial to involve patients in health research, to describe the various levels of engagement that patient partners can be involved with, and to identify available tools and resources that will support the conduct of patient-oriented research. So to set the stage a little bit around what we're talking about, this is the health research to practice continuum figure, and it sort of describes, the problem behind what the strategy for patient-oriented research is trying to fix. So with health research specifically, it does exist in a slightly different context than other types of research. No matter what kind of research you're doing, there's always a risk that the evidence generated through that research is not making its way to real-world impact. But health research specifically does present different obstacles. Healthcare is often a slow to change field. Policy change around healthcare can be really bureaucratic. And practitioners and decision makers and administrators are not likely to take chances on new advancements until that body of evidence for a new approach is really rock solid. And that can take years or even decades. There are lives on the line, and money is obviously not easily reallocated in the healthcare world. However, the valley of death metaphor is equally appropriate to describe these two major gaps that we often see in that health research to practice translational research continuum. The first really being that the translation of laboratory discoveries to human subjects has its own sets of challenges, right? It's really difficult to go from testing in the lab to testing on people. And so there's a valley of death there. There's a second valley of death when it comes to translating that resulting evidence to clinical and public health practice and policy. So the gaps between what we actually get between the research of testing on people to the changes in the system and when it comes to health decision-making and clinical practice. And this has real world impacts, right? So this can lead to what the research has shown us, that 30 to 45% of patients are not receiving care based on scientific evidence. Whether it's because it's not the most emerging evidence, or whether because it's wrong evidence, because it's not critically appraised, because the right evidence isn't necessarily being indexed, or because what's being indexed isn't necessarily a holistic picture, or because the right partners aren't at the table to also offer different perspectives. And so this leads us to Canada's strategy for the patient-oriented research. CIHR, which is Canada's International Health Research Funder, really saw these issues in the losses of research and the failures of research, that they are not necessarily failures, but in the gaps in terms of the research that they were funding and the amount of impact that that research was actually generating in the healthcare system. And so they created this strategy for patient-oriented research. And this was Canada's strategy to ensure that the right patient receives the right intervention at the right time by increasing the amount of research that's being conducted with and by research knowledge users. And when we mean research knowledge users, we mean people who are going to be able to use those results and that evidence. And that might mean patients and caregivers for their own health. It might mean healthcare providers for how they're providing care. It might mean healthcare administrators for the types of programs they're developing. It might mean decision makers for the types of policies that they're also supporting. Another sort of, I guess, thing I want to bring up is our team really looks at health and health research very broadly. So SPORE might have emerged as a response to biomedical and clinical health research, but a lot of our teams look at really broad senses of health. And so we're looking at things like preventing falls in elderly populations, wearable biotechnology, walking neighborhoods, anxiety toolkits, quality of life measurements, dietary needs, priority setting, and so on. And so we use a really broad definition of health to justify the use of patient-oriented research approaches. So I'm going to pivot here and talk a little bit about the support units and what they are. Support stands for Support for People in Patient-Oriented Research and Trials, and these units are provincial elements of Canada's National Strategy for Patient-Oriented Research. BC Support Unit is one of 10 SPORE-funded support units across Canada. There are 5 BC Support Unit regional centers that operate in BC. We are the BC Support Unit Fraser Center, and we support patient-oriented research in the Fraser Salish region. And so that means that we're a partnership between Fraser Health and Simon Fraser University, but we also work with other academic institutes in the area. And what this means is that there's an institutionalization of PORE at both of these institutes. It means a dedicated allocation of resources to PORE, leadership support for PORE, and most importantly, fostering important networks between academia and decision makers. So currently, as I record this presentation, our BC Support Unit Fraser Center team is composed of 3 staff members. One of our staff members is a Simon Fraser University employee, and the other 2 of us are Fraser Health staff members, and we are fit within the Department of Evaluation and Research Services at SFU Central City. And so the BC Support Unit aims to bridge the gap between research evidence and healthcare practice by providing patient-oriented research support services, by strengthening and maintaining BC's capacity in patient-oriented research, and by engaging stakeholders as active partners in both research and its use in healthcare practice and policy. As I record this presentation, the BC Support Unit is in year 7 of 10 of our phases. We're currently in the second phase, and our first phase was really aimed at supporting that capacity in patient-oriented research, in trying to spread the message about patient-oriented research, and trying to support teams as much as they could to adopt that approach. And that's a lot of what we still do today. And so some of our supports to you all at Fraser Health could be things like patient engagement plans, knowledge translation plans, and working with patient partners to be involved in research and evaluation activities generally. So at this point, we're going to pivot a little bit and talk about patient engagement as sort of an introduction to what we mean by patient-oriented research. When we talk about POUR, it's really a model that's building on a patient engagement movement that's been ongoing for decades. I think really this movement has really found its feet in the 70s and 80s. And overall, it's a social movement that has been building momentum at a rapid pace over the last few decades. It's a concept that's well described by the phrase, nothing about me without me. Um, and this really emerged because patients, were noting that shared decision making really does have the potential to improve health outcomes, improve patient and provider satisfactions, and save costs. This perception emerged because, we were making great strides in scientific discoveries that were indeed improving health outcomes, but yet patient satisfaction was really low due to poor experiences. And at the same time, healthcare costs were burgeoning. And so, as a response to this, came the idea that patients really were partners in their own care, could make those informed shared decisions, could act as advisors in health system quality improvement, and could also be partners in health research. And so patient engagement in health research is also building on a history of community-based participatory research. At its core, community-based research is collaborative, concerned with equity, involves community and university scholars as equal partners, and combines knowledge with action, usually to achieve social change. And there's a wide school of thought behind both of these disciplines. I've linked to one resource here as well. Patient-oriented research specifically, which I'll define in the next slide, really does borrow on a lot of these principles. The focus of POUR is just around realigning that typical model of research, specifically in the health field. And so POUR, when we define POUR, this is sort of how we're defining it. One quick note is that patient-oriented research, or POUR, is Canada's approach, but there are similar initiatives in the UK and the US. All three initiatives have slightly different approaches, but they all have roots in community-based research and branched out from there. And so when we talk about POUR, what we're defining as POUR is that it engages patients as partners in research and not as participants. So this is very different from engaging patients as study participants. We're not engaging patients to draw data from them. We're actually engaging them to support us in the decision-making of research practices. And so patient partners are considered equal members of the research team. Patient-oriented research also focuses on priorities that have been identified by patients to improve outcomes that have also been defined by patients. It aims to apply knowledge that's generated to improve healthcare systems and practices, and is also conducted by multidisciplinary teams in partnership with stakeholders. And what we mean by multidisciplinary teams is that we really have a diverse set of knowledge users at the table. Clinicians, other allied healthcare professionals, other healthcare providers, academic researchers, decision makers, administrators, evaluators, and of course, patient partners, caregivers, family members, etc. And so again, what we mean is that research is done with and by patients and not for, on, or about. A quick note here about terminology is that patient isn't always the right word. When we say patient, we're defining it as any person that has experienced a healthcare issue or the healthcare system, including informal caregivers, family, friends. We recognize that, patient isn't always that right term. It turns some people off. And in fact, there are a lot of people who prefer to be called clients, residents, public members, community members. And I think what's important here is to recognize that lived experience is the most critical. And so it's always important just to ask your partners how they would like to be identified or defined, and then you amend your language accordingly. And so again, what we're doing here is shifting our thinking about shifting our traditional perceptions of the research model and who's generating and receiving or using knowledge. So this slide shows that traditional model of academic researchers generating knowledge and passing it on to others as knowledge users. What we're trying to do is flip this model on its head and create space for all of these types of roles to be knowledge producers and users, exchanging experience, learning together, and leveraging each other's expertise to generate higher quality evidence. This engagement can occur anywhere in the research cycle, from research question generation and grant writing, all the way to data analysis and dissemination. And we'll talk a little bit more about some of those examples in terms of where in the research cycle the sort of collaboration can occur, which is everywhere. So again, this is just an example of different terminology that might be used. It's not always, patient might not always be appropriate, but we're really talking about individuals with lived experience of a health issue that's relevant to the focus of that research. And so with patients really, what matters to them, of course, is being heard, being seen. But what they're really after when they're engaging in these sorts of activities is those real improvements to the healthcare system for those that come after them, and better health outcomes and experiences. And so really making sure that we're following through on the research and that we're involving patients with that KT piece is just as important, because that's really the reason why they're getting involved with this research. So why do we engage patients? This is a really great figure. I love this figure because it really shows, I think, the difference between what happens when you design something without really taking user experience into account. This is an image that shows, the architects probably a paved path, and yet there is a path that is more trodden because it is shorter and it gets from point A to point B quicker. And it tends to be the path that most people are taking anyway. And so it's important to consider the patient perspective before you actually implement a program design, a research question, a research study, and those sorts of things. There's a lot of other benefits, of course, of patient engagement in health research. Just to reiterate some of these, it improves the relevance of the research and makes it more likely to actually have an impact on patients. It improves the quality. There's a greater impact on the lives of patients in the healthcare system. It leads to more ethical research, fosters inclusive mechanisms and processes, facilitates multi-way capacity building. So there's a lot of opportunities for many members of the research team to learn how to communicate and collaborate. It emphasizes that experiential knowledge, so knowledge that we're actually, based on our lived experience, that's valued as evidence, and it's mobilized and translated for impact. And there's a shared sense of purpose. And I think most importantly, it's that moral imperative around nothing about us without us. There's a number of studies and scoping reviews that have been done to illustrate the benefits of patient engagement in health research. And so I offer some of this literature here just to highlight some of those benefits that do exist, and sort of how that impact that it does have in the healthcare system. So when we talk about patient engagement, we're really talking about these guiding principles. And so patient engagement, what we're working under that is defined as the meaningful and active collaboration in governance, priority setting, conducting research, and or knowledge translation. And it's guided by these principles of inclusiveness, support, mutual respect, and co-building. And these are some of the quotes here that have been offered by patient partners and those who work with patient partners that really, I think, will encapsulate the sort of principles and impact of patient engagement as a whole. Um, I really like this figure because I think it kind of well demonstrates the domino effect from what it means to engage with knowledge users. And when we mean knowledge users, again, we're talking about patient partners, healthcare providers, program staff, administrators, caregivers, um, researchers. But when we identify with all of those knowledge users and they undertake research, there tends to be a multi-way collaboration in terms of that research. Research tends to be conducted in areas that the knowledge users also value. These knowledge users then influence and accelerate decision-making, translation, and uptake of new practices. And this results in improved experience, improved health outcomes, and more sustainable healthcare system. And so I really offer this to drive home the point that there is value in engaging with a wide variety of knowledge users, particularly patient partners, in order to really see an impact and a change in the healthcare system. We're not going to make a change if we just keep asking ourselves the same questions. And so it's important to gather all those different perspectives when we're thinking about making a change and uptake of new practices. This is a really great example in terms of the importance of engaging with patients with lived experience. Um, and this example is around spinal cord injury research. So the majority of research prior to the early 2000s around spinal cord injury focused on getting people back to walking. It was millions of dollars going into spinal cord injury, and the majority of it was just focused on outcomes that a researcher who themselves had a spinal cord injury knew wasn't anecdotally the main priority. So because they had their own lived experience, they sort of knew, okay, I don't know why so much of this research is focused on walking when it's not necessarily a patient identified outcome. And so this researcher surveyed 700 people with spinal cord injury and actually found a whole number of different priorities. They found that those with spinal cord injury are actually much more concerned with things that affect their daily quality of life, their bowel care, their sexual function, their hand function. And very little research was actually being done to support these priorities. And so this priority setting work led to a huge research program and many knowledge translation products for patients and providers that really improved care and quality of life for people living with spinal cord injury. That would not have been done had the lived experience not been a key component of that story, and had patients not been engaged to identify research priorities. So the next few sections or next few slides are going to talk about some details around patient engagement and how to develop a patient engagement plan. Just no matter the field that you want to work in or the size of the project, if you want to start engaging with a patient partner, you want to start with creating an engagement plan. There needs to be a plan in place before you start, so you can start with intention. If you don't have the right people on board, you might not succeed in finding your population, getting the data you need, implementing your findings, or making an impact. We need to plan for engagement of all knowledge users, not just the public and patients. And your plans might be different for different knowledge user groups. But your plan is typically going to ask the following questions. You might want to ask, who have you engaged with or plan to engage with? Why those people. So, why are you targeting these knowledge users? What will they contribute to the project once they're engaged? And how will you initiate an engagement with them? And we're going to unpack some of these questions a little bit more specifically. So let's talk about the first question. Who do I need to engage with? You really want to ask, who is the research about? Who might find your research relevant in their life or in their work? Will anyone be personally impacted by your methods or findings? So, for example, if your research is about dietary needs or dietary needs for people with type 2 diabetes, you might want to engage patients and caregivers, patients who have type 2 diabetes and caregivers who support those patients to better inform some of your dietary needs research. You might want to engage with dietitians. You might want to engage with other healthcare providers as necessary, depending on that research. But you want to think through, will anyone be personally impacted by my methods or my findings? You also need to ask, who do you need on board to make sure the research happens? So you might want to ask yourself, do you need approval from any department heads or management? Do you need involvement from certain staff groups to help with recruitment or consenting? Do you need financial or in-kind support from anyone? Do you need access to people or data? Um, and are your patient project partners representative of your population? Is anyone missing? And of course, we understand that we can't always include all voices and perspectives in every project, but we need to keep equity, diversity, inclusion, and access at the front of our minds when we consider who needs to be engaged. And so you really do need to ask the questions around, who is your population? Are your patient partners representative of that population? Are there any underrepresented voices that haven't been considered? Have you created an environment or an opportunity for those voices to come forward? And as a note, it's always best practice to have more than one patient involved as a project partner. The next question that kind of comes to the engagement plan is around, why are you engaging with those people? And this is really meant to help you hone in on your engagement plan and focus it, but also to help you avoid engaging people in a tokenistic way. You need to have a really genuine and good reason for engaging. So you might want to ask, are you answering a question that matters to knowledge users? Are you using language that's appropriate for your population? Those are all sorts of considerations where engaging with patient partners might contribute. Often, grant applications and administrative approvals may require some level of engagement as well. So often, we're seeing a lot more grants require a patient engagement plan. Patient partners can also, offer feedback on feasibility, scope, timelines. Are you engaging with them because they might be able to help with recruitment? Is that population appropriate for your research strategy? And so these are certain reasons why you might be engaging with patient partners as well. The way to engage, so how you're going to engage with them, is somewhat dictated by what you're looking for from each person and how they would like to be involved. Always ask, don't assume. A common misconception is that people don't want to be bothered and want to be involved as little as possible, but that's not necessarily the case. So just ask people what they have the capacity for or they're interested in. It's also helpful to consider this scale of engagement levels from the International Association for Public Participation. The scale goes from inform, which is the lowest level of engagement, to empower, which is the highest level of engagement. None of these categories are better or worse than the other, and they can all be useful in different contexts. And what will your partners contribute? You always want to describe the whole project and ask what interests them. People bring rich experiences and skill sets to projects and are more than just their lived experience of a certain topic or issue. And so asking them how they would like to contribute builds trust and makes the work better. Applicants or not applicants, sorry, project partners, patient partners might have skills that they want to engage in and that they want to contribute to this, such as scientific communication, writing, editing, reading, presentation skills, analysis. There might be a whole range of skills that they're really interested in, and asking them what they want to contribute is a really good way of facilitating that conversation. It's also good practice to sort of note that in a terms of reference or some sort of guiding document and to sort of set expectations for what that involvement can look like. And so again, we've sort of talked about this spectrum again. I'll just skip it because I think we've talked about a lot of this content. But this is another slide that sort of offers a few example strategies that fit under some of these methods of engagement. So if you were to inform a population, it might be something like handing out a newsletter, a website, maybe a kiosk, things like that. Involving, collaborating, and empowering are usually when you might be engaging in forms of decision making that have slightly more of an increasing impact. And so these forms might look like things like an advisory group, a working group, a steering committee, a governing council. Core models tend to fit in the involve to empower end of the spectrum. But again, this is not a one all and be all, and they can also extend to involve and consult, depending on how the patient partners would like to be involved and engaged. And so it's really up to you to ask, some patient partners would like to just receive updates and provide their input whenever they'd like in whatever capacity they want to. Others want to be more engaged in every step of the decision making. And so that's a conversation you can have with your patient partner and the rest of your research team. This diagram shows the research cycle, and we typically use it to illustrate places where patient partners can contribute to projects, which is everywhere. And so today I want to highlight there's a lot of other responsibilities that also exist outside of the cycle. Project management, coordination, and communication of project personnel and participants and other vital roles that need to be accounted for. Those roles those activities that typically happen in a research study, those are typically activities that a staff person would do and not a patient partner. And really important to designate a staff person to do some of those project management and communication and coordination pieces to ensure a consistent and smooth project. But patient partners can be involved in setting priorities and formulating the study question, identifying your study population, your recruitment strategies, choosing relevant outcomes. They might be involved in data analysis and interpreting the findings and the relevancy of those findings. They can also be involved in designing implementation activities, translating those documents into plain language and other strategies that might be effective for patients and communities. They might also help develop practice guidelines and inform evaluation practices. Um, and so these are just some other sort of guiding questions when it comes to creating a patient engagement plan. Other questions to ask yourself as someone who's a research team member or someone who might be starting to walk that journey. In developing a patient engagement plan, how are you meeting people where they're at? So, what's their level of health research knowledge or health research literacy? Do you need to provide them with any other reading materials, any other support, training, orientation, learning, so that they can feel supported and feel that they're able to show up and be engaged with all the supports that they have? Do you have a point person on your team for patient partners? So we do typically say that it's best practice to identify one point person at least who can be that liaison between patient partners and be that person that communicates with the patient partners, that provides updates if a patient partner can't attend meetings, that provides check-ins to the patient partners, that provides an opportunity for the patient partner to voice any concerns they might have, or is just generally a safe space. You might also want to consider what's the preferred method of communication. So, do they like online meetings? Do they like phone calls? Those sorts of things. What are the roles and responsibilities for all the team members? And how often are you checking in with patient partners? Our team at the BC Support Unit does have a patient engagement planning template, and we can help walk you through a lot of these questions. So it's a free service that we offer to everyone at Fraser Health who would like to start, adopting a patient-oriented research approach into their research. And so you're welcome to reach out to our team, and we can chat a little bit more about how these questions might look in your context and study. It is true that doing this work is a shift from the traditional research model, and it doesn't come without challenges. Um, it does require time and effort and additional resources, and that can be built into grants and timelines. So there is a recognition that engagement does take time and effort, but you can start thinking about how to build that into your grants and timelines. And of course, working with our team can sort of help navigate how you might budget for some of these pieces. Um, Power dynamics can be another challenge that can come up. It can be hard for researchers or for people in traditional positions of power to give up control over their work, but it is necessary in this kind of approach. Um, Doing this work can take resources. Back to that point, we do need to make it the norm to build additional time and money into our grants in order to do work like this properly. Um, and so it's important that we do recognize that patient partners who are volunteering their time to engage in this way and are not staff should be reimbursed for out-of-pocket expenses, and if possible, should be compensated for their time. We also need to build in flexibility and the ability for timelines to shift. Oftentimes, this work is very iterative because of the amount of knowledge users that are involved and because of the scope of relationship building that often needs to occur before the work actually gets going. And so it's important to just build those timelines into your grants and to things like that. Tokenism is also can be a key challenge when it comes to doing this work. And in order to combat tokenism, first you really need to consider, why are you engaging? Patients should be diverse in their experience and representative of the population that you're researching. And engagement should be meaningful, genuine, and culturally safe. Your partners should be included as equal team members, which means thinking about engagement really early on and not bringing people on last minute. That commitment to mutual learning and collaboration, and making an effort to maintain enduring relationships. So again, it does come back to that piece of forming strong and lasting relationships and taking that time to build trusting relationships between your knowledge users to overcome a lot of these challenges, including tokenism and power dynamics. And so having partnership agreements, a terms of reference, or something that documents how the term will work together can be a really good strategy. in terms of conflict prevention and facilitating smooth teamwork. These are both strategies that can, that can be worked through by working with the Fraser Center. We can help, facilitate strategies for conflict prevention and conflict resolution. But some of the strategies that we suggest for conflict prevention are things like terms of reference or partnership agreements, creating an environment where everyone is heard and feels heard, open and continuous communication, building and maintaining relationships, and team building exercises. Conflict resolution, some strategies we also suggest are engaging with the Fraser Center to possibly support you in navigating a conflict resolution. But regular check-ins can also help catch things before they bubble up. Acting early when an issue arises. Going back to your terms of reference and partnership agreements. Finding a neutral third party to adjudicate, and that might be the Fraser Center. But perhaps maybe also recognizing when it is time to walk away from a partnership or finding another opportunity for someone to engage that might not look the same as that one. Again, those are all strategies that can be discussed further with the Fraser Center if this ever were to arise. But of a lot of what we've discussed already when it comes to the questions that would be part of your patient engagement plan will go a long way to mitigating and preventing conflict from happening. When it comes to engaging with Indigenous people, of course, there's a recognition that historical harms have been caused by a colonial research enterprise. And so when it comes to engaging with Indigenous peoples for research, engagement is not optional. Research generation will come from the community and is supported by others as needed. And so the way that we see engagement with Indigenous peoples in research context is always that that's research led by the community, and we can support as needed. Fraser Center is working with Métis Nations BC, the Indigenous Cultural Safety Team, the BC Network Environment for Indigenous Health Research, and other academic and community partners to develop a protocol for engaging with Indigenous peoples in research and evaluation that will be specific to the Fraser Salish region. So just keep an eye out for that. That will be shared in the coming, probably coming year or two. I'll touch very briefly on this notion of trauma and resiliency informed practice in a research context. Oftentimes, people join research projects as patient partners because they may have had a negative experience in their own care journey and want to improve things for future patients. However, these negative experiences can carry trauma, and by participating, we're asking people to share those traumas. Often to lots of people, sometimes for free. And so we need to be mindful of asking people what they're comfortable sharing, planning ahead so we don't put them on the spot, and drawing clear lines around what people are comfortable with the research team sharing in publications as well. And something I've learned from my colleague, Beth Pomeroy, who is an expert in this work, is that we need to remember that sharing and vulnerability cannot be a one-way street. And that as part of relationship building, we need to be willing to share our own experiences and be compassionate for ourselves and those we are working with. And so I offer some reading here to dive into trauma and resiliency informed practices a little bit more. There is some training available for trauma and resiliency informed practices for research and evaluation specifically as well. But to wrap up, engagement does take time. I think it's well defined by these three sort of these three themes. Collaboration. There are multiple knowledge users that need to be involved in engagement and patient-oriented research. It's also defined by curiosity, and it's also defined by humility. And I think a constant key for success when we're walking that poor path is that it's a constant journey of learning. The next section will just be a few tools and resources that we've linked to for you to dive into a bit further on your poor journey. There are some tools and resources that can help you guide reimbursement and compensation guidelines. So reimbursement would be the repayment for out-of-pocket expenses, for example, childcare, parking, mileage related to engagement of an activity. And compensation is something awarded to someone in exchange for a service, and so this may take the form of an honorarium or in-kind gift. But it's typically used in thanking patient partners for their involvement with research. And so these are a few tools that can be used to support you in budgeting for patient and public engagement in health research. I've also linked a few tools here for actually how to recruit patient partners. Reach BC is the best first place for you to go. It is BC's it's a recruitment platform in BC for participants and patient partners in health research. And so you can look for both participants for your research study as well as patient partners. Patient Voices Network is also a great avenue for recruiting patient partners. If you're looking at something that's more advisory or more QI focused for patient partnership, then I would recommend Patient Voices. But you can also look at community organizations and health networks to recruit patient partners. And a quick note is that if you're struggling with recruiting patient partners, it's also something that the BC Support Unit can help you with. So our team can chat through some suggestions of how you might be able to recruit patient partners based on your unique study and your questions. These are just a few links around equity, diversity, and inclusion in research. It is a core part of how we're viewing research and how we're viewing patient-oriented research. And it's something that we're also evolving on in terms of how we as a unit and as a team can be advancing equity, diversity, and inclusion in the research that we're supporting. I've also linked to some tools here for creating a culturally and socially safe environment. And so just some other tools that we can use to tangibly create a more equitable and inclusive environment. This is a fantastic resource that was actually developed by the BC Support Unit with patient partners. And it was designed to show the many ways in which patient partners and members of the public can be engaged on a research team. So I'd recommend clicking on the link. If you hover on each of these activity areas, it'll show a whole number of example ways that patients can be engaged for these various stages that might occur on the research journey. So Fraser Center has been around for about 6 to 7 years. Yeah, 6 to 7 years. We've been supporting over 100 research projects since we first started. And we've also supported 129 patient partners in research and governance activities. What's also really awesome is that 3 of those studies were actually patient-directed. And so patient partners came to us saying, we really want to find research partners to work with about what we're passionate on. And we were able to make that happen for 3 of those studies, for 3 patient-directed studies. Our patient partners are uniquely involved in our operations and governance activities. So we have a research-ready patient partners group. which is a group of research-ready patients who want to be more actively engaged in shaping research processes and agendas, and assisting with feedback to researchers on research ideas, assisting with recruitment, etc. We also have a core oversight committee that provides strategic, operational, and fiduciary oversight for our center, and is composed of representatives from SFU, Fraser Health, and patient partners. Our patient partners also really support us in shared decision-making when it comes to activities that our center might put on. And these are some projects that we've supported. So I just wanted to provide a few examples from projects we've supported. So this project was thought up by some South Asian researchers and health providers in the region who understood that South Asian engagement in research was severely lacking, despite a huge South Asian population being affected by health issues. So there was a real gap that they weren't really being accounted for in the types of research that we were focusing on. Our team helped support this project team with planning, recruitment of patient partners and participants, and facilitating a priority setting process to improve the quantity and quality of health research for the community. We supported a strategy for and facilitated goal-setting activities. And we also supported knowledge dissemination activities. We were able to establish meaningful relationships with community and worked with community to recruit at community events, local places of worship, to recruit 238 participants to complete priority setting practice surveys. Another example of this project is the Fracture Liaison Service. This is led by Dr. Sonia Singh at Fraser Health, who identified that there was an osteoporosis care gap. Dr. Singh knew that there was an evidence-based model called the Fracture Liaison Service that was recognized as an effective model to address an osteoporosis care gap. And Dr. Singh used implementation science methods to assess context, adapt the Fracture Liaison Service, implement it, and evaluate its effectiveness. There were a lot of challenges faced in implementing Fracture Liaison Service, but having a patient partner on the team was really critical to its success. Patient partners were involved in identifying the problem, priority setting, adapting the FLS to make it more relevant to their experiences, and they helped foster legitimacy and buy-in with decision makers and leadership so that this intervention could eventually be implemented. This team has now received a grant to scale and spread FLS across BC. They've also received a grant to develop health policy related to the Fracture Liaison Service for BC. So our center, BC Sport Unit and Fraser Center, does offer a number of webinars, online training resources, and a website that you can learn more here. We as a team provide services and supports in POR and KT. So we can support patient engagement by discussing frameworks, developing plans, sharing best practices for compensation and reimbursement. I can also provide support in knowledge mobilization. And we also offer tailored workshops to research teams depending on their needs. So get in contact with us to learn more. And again, if you'd like to contact us, these are all of our socials. This is the website for the BC Support Unit right here. And thank you so much.